Hello, my name is Nina. I welcome you to the presentation of BT2, the most effective system to solve deep bite. In this presentation, I will explain when and why it pays to use BT2 and how to use it. Deep bites, 75 to 120%, are among the most challenging orthodontic treatments and are highly susceptible to relapses. One of the main reasons is increased muscle hyperactivity, which has long been associated with causing overbite. However, the genetic predisposition of the central nervous system and the patient's personality are primary factors compared with simple muscle hyperactivity. Let us now look in detail at BT2. BT2 is a device specially designed for the rapid solution of deep bite. It is made of metal and has a slot along the vertical axis, allowing a probe or similar tool to position and glue it more precisely to the tooth. This same groove is helpful when removing the BT2 from the patient. By applying gentle pressure with an instrument, the two walls of the groove collapse, lifting the base so that the BT2 is removed without pain for the patient. This patented curvature reduces overactivity and muscle parafunctions, performing effective guidance to facilitate sliding of the lower incisors. BT2 has an 80-gauge mesh base to ensure high bonding strength. The base has a unique design so that it can fit perfectly on the lingual side of the upper incisors, thus improving resistance to palatal shear forces. BT2s are very small to be comfortable for patients and facilitate oral hygiene. For better patient comfort, it is recommended to apply orthodontic wax for the first 2 or 3 days of treatment. On the other hand, the side grooves are convenient gripping points for easy placement using a tweezer with a curved tip. Let us now see where and when to use BT2s. In Class 2, BT2s are placed on the third incisal region of the upper central incisors. It is recommended to use BT2s at the time of bracket placement. In addition, once the bite is open, it is recommended to use elastic bands posteriorly to help erupt the buccal segments. BT2s are recommended at all ages, both in adults and in interceptive treatments in children. The time required for deep bite correction using BT2s can range from 3 to 6 months, depending on the case's complexity. The mechanism of action of BT2 is that increasing the vertical dimension reduces the tension-related muscle hyperactivity of the central nervous system through the hypothalamic adrenal pathway. When the bite is opened, rhombus-shaped elastics are often used posteriorly to extrude the buccal segments and for moderate intrusion of the incisors. Class 2 correction is managed by a differential eruption of the posterior sectors. The upper arch is maintained in anchorage with an 18 by 25 steel arch. In the lower one, a 16 by 22 arch will allow differential extrusion of molars and premolars. This procedure allows BT2s to work effectively by simultaneously increasing the interior vertical dimension and the bite opening using elastics bilaterally. In addition, the use of BT2s is extremely useful in the correction of asymmetric malocclusions. Their immediate application at the start of therapy will allow for disclusion between the arches. A certain degree of disclusion will allow an immediate repositioning of the mandible, then stabilized by the extrusion of the posterior sectors. Thank you for your attention.